Hi and welcome back. I'm here with Scott Cook again.
Hello.
We are going to continue our talk on pain and sensitivity. We have spoken already about the physical side of pain. We've also spoken about how sleep and fear and anxiety can contribute to pain and sensitivity. So today we thought we would cover thoughts and beliefs, mood and sort of social factors that can influence how we're feeling and how we feel our pain essentially. So Scott, can you tell me a bit more about the thoughts and beliefs that patients have when they come to us and how this can affect their pain?
I think the first thing to kind of point out is that patients' thoughts and beliefs are really powerful. They're kind of big influencing factors in what people do, the decisions they make, how they feel about their problem. So I think it's really an important factor that often gets overlooked. And I think access to information has played a kind of pivotal role in influencing patients' thoughts and beliefs. So whether that be, false information that's given to patients, they've been given information that has negatively affect how they feel or how they view their problem. Whether that's you've got an arthritic knee because you've had an X-ray and all the horrible things on that scan have been pointed out and maybe it hasn't been explained properly, it hasn't been put into context. And then a patient walks away thinking, right, well, I've got this degenerative arthritic problem. We associate as a kind of society that a degenerative problem is a wear and tear that is going to get worse, and that then we change the way we change the way we view about these issues, which then influences our behaviours, our decision making, what we do. So I think it's really important to understand that how we feel about a problem can influence what we feel.
Do you think as clinicians sometimes we have an answer, a role to play in this as well? In the patient comes to you and I and our colleagues, they'll come in and say something along the lines of, I've been to see this doctor and he said to me that I've got the spine of an 80-year-old or I've got a crumbling spine. And this is really damaging, isn't it, in terms of how that patient perceives that information and what they do with it? Yeah,
most definitely. I think the one thing that we don't do very well do very well at is to put context. We interpret scans. We still scans are really important and they can be really useful. In ruling out serious pathology, cancers, tumours, all the rare things that actually are really uncommon. It can be really good at ruling out, but actually when it comes to ruling in, they're not particularly always that valuable. So I think what's really important is to put context to the situation. If we recognise that someone's got pain, it could be coming from the fact that they have got some degeneration, some wear-in, disc bulge, which can cause pain. That doesn't mean they're doomed. That it can improve, their pain can settle, their function can restore with the right approach. And I think the one thing that's really important is that it's often a mixture of all these different factors. So putting context to the situation is really important, and I think as healthcare professionals we're in a very nice position to educate and influence, but also put patients at ease. And that is going to help to influence their thoughts and beliefs.
We were talking before about how exercise and education plays such a big role in what we do. One of the problems with education in the past has been the negativity of that. And the words that we use to patients, the things we say to patients, and you mustn't do this, you mustn't do this. I think it's all been negative and not positive enough.
And we've done that as a society. You've only got to look at manual handling programs, where we have, for health and safety reasons, taught people how to sit, how to bend, how to lift. And actually statistically it's made no difference to kind of the prevalence or incidence of back pain, for example. So as a culture, we've kind of bred a society of people that are fearful of stepping outside of that set way that we've been taught you should do things. And that creates these kind of fear of movement, or this, don't do that, it's bad for your back. I mean, you get people that haven't got back pain saying, oh, don't do that. Don't bend like that. Why?
Because you get a bad back.
Because you get a bad back, but they haven't got any pain. They're fine. They're fit, healthy, well, and we're kind of installing these behaviours, which then influences that. And I think that's really important, that people's thoughts and beliefs change behaviour. That's really important. And then once you start changing behaviours, you start changing people's kind of viewpoints. You start looking at fears and anxieties, and then it links over with kind of this fight or flight, gradually sensitising tissues, and it kind of plays in that.
Can I ask you a question about that? You just said there that someone might say, "Oh, don't do that because you might get a bad back." Can you just explain to the listeners and the viewers why that person without the bad back won't get a bad back from lifting in relation to some of the things you spoke about before?
Yeah. So I think providing your body is conditioned and ready to do what you want it to do, it handles it really well.
Yeah.
And I think the key bit is to make sure that our body's in a position to handle what we want to do with it. And that could be physically, being strong enough to lift what you want to lift or to perform the task that you want to perform. It could be moving with good quality, good variability. It could be you're well rested, that you're in a good place mentally. And then if you've got enough of these things in place, then your body handles things really well. It's when some of these things kind of come out of kilter that then you start to get potential issues. So sometimes it's not even the task of what we're doing physically, it's about how our body tolerates that task that's the most kind of important factor.
So it could be someone that, for example, is suffering with some stress, hasn't had very much sleep in the last few weeks because they're anxious, they're stressed about a situation, they haven't been very physically active because of these things, and then they're asked to do something in the workplace that takes them out of that functional envelope, if you like, and tips them over the edge, and they then get the back pain, not because of the way they lifted, these other factors.
Yeah, exactly, and I think, we see a lot of people doing an everyday task, so they bend down and they do their shoelaces up and their back goes. How many times in your life do you do your shoelaces up and you don't get any pain or any problems? So what's the difference between now and another time? We know that a high percentage of patients, I think it's 50 to 70% of patients, have disc bulges and wear and tear and degenerative discs on their scans, but don't experience any pain. So why has one person got pain and one person haven't? It has to be because of all of these different factors and how they affect that individual, from their physical condition to their sleep, to their anxiety, to their stressors. And it's down to us as clinicians to work with you guys as patients to unpick what factors are relevant to you, and then put a treatment plan in place to kind of address those issues. And that is how we would push people to try and approach their problems nowadays. Don't go into a clinic, have a massage, get off and think it's all muscular and your body's gone into spasm and you've got pain because of no reason. And there is a reason, it's down to us to unpick that, and I think that's really important. And part of that is really educating and understanding about what is really true and what really isn't, because there's a lot of misconceptions, there's a lot of crap information that's out there that is just not putting patients in the real picture about what they need to think about.
And I think we've spoken a lot so far about how this links together. You can quite easily see that the thoughts and beliefs of someone can quite easily influence their anxiety and their stress. So there's a lot of interplay between these components.
And then what you don't do is you don't move because you're fearful of moving, and then you don't exercise, so you reduce your load, and then it has this kind of cascade of events that end up with a painful, low, deconditioned person that's not sleeping great, that's fearful, and that creates quite a muddy cocktail that needs a lot of unpicking and needs a lot of work to rebuild that back up into a healthier place.
It's always a diagnosis, that muddy cocktail, I like that. Okay, so if we're talking about this side of the board here, we've got a few factors we haven't yet mentioned, which is the social factors and the mood. And I know I saw someone this week that came in, and this particular person that had a marital breakup, they'd had some issues going on within the family dynamics, and around the same time she started to develop problems. And when we dug a bit deeper, it turns out that a lot of her fears and anxieties were all related to the social aspect that was going on at home. And her symptoms have amplified as a result of that. Her pathology is only worse. The MRI scan doesn't show any changes at all that there weren't there 5 years ago. And the only difference in her life is her social setting. So, I mean, do you have much experience in dealing with that kind of stuff as well?
Yeah, I think that definitely plays an important role. I mean, the exercise, feeling good, feelings of self-worth, feelings of kind of, well-being, emotional and physical well-being are feelings that make us feel good. They release feel-good hormones, they release endorphins, they kind of make us feel good, they make us achieve. So while that has a positive effect, it can also, when it's not present, have a negative effect. So, feeling low, not feeling like you're moving forwards. It could be in a career, it could be in a relationship, it could be in life in general. Can have a negative effect on how we feel, and thus increase and sensitise our nervous system. Also, once you get into that state, the one thing people often don't want to do is socialise, and they don't want to exercise, and they attend classes or get out and do things, you know.
So that reduces those happy hormones even further.
Exactly, and then it has this knock-on effect like we've just spoke about.
Yeah.
So I think be aware of your surrounding story. And I think often people who have you know, a worsening pain picture can often link that or make links to more of a worrying time of their life, whether that be work, relationships, friends, health, you know, whatever that may be. And I think it has these kind of knock-on effects with all these different factors. So part of what we've got to look at is how someone feels. How do you feel in yourself?
And that's what we ask, isn't it? When they come in, one of the questions we ask them is, how are you in yourself? What's going on? Because this has such a big impact on the way that things are going to go. And if we don't know that, we're not going to get better.
And that's where the goal setting comes in. What do you want? What do you want to be able to do that you can't do now? Where do you see your life in a year, 3 years, 5 years' time? And part of what we do should be looking at getting someone to get closer or achieve those what are effectively our life goals.
And it may well be that this person needs to spend more time working on these factors or it might be that we need to work a bit more on these, depending on that balance that's at play here. And proportionally, they change from one person to the next, don't they?
Yeah, and I think from my point of view as a physio, I think one of the big things that's changed over the last few years, 3-5 years, is that I'm doing less of this, or I'm using this as a platform, exercise as a means to address all of these other factors. And I think historically, if I look back at the patients that potentially didn't get better in the past, that it's often because of not looking at these factors, and they wasn't made clear to us as clinicians. And now I think there's a big push to recognise these other factors and the role that they play.
And I think as a clinician that comes with experience and knowledge and understanding, and having patient mileage as well, knowing, spotting these things when you see these patients coming in, and being confident as well to move away from the traditional model, which is lay down, I'm going to rub your back, it'll all feel better, to actually let's approach some of these subjects and talk about them, whilst we're still going to do some hands-on to loosen the stiff bits, and we'll do some exercise to improve the way you move. We definitely need to address these things. And having the confidence to do that, and having the patient on side, and the patient understanding that this is what we're doing and why we're doing it, so that we don't lose their trust, and therefore don't get where they want to get to.
Yeah, definitely. And I think there's a takeaway message from these videos. I think what's really important is for patients to understand the relationship that they have with their professional, their clinician. That it's us working with you to address these issues, to help move you forwards and get where you want to get. And sometimes that is through exercise and strength work and technique differences or technique changes. And other times it's to do with talking
and listening,
you know, and kind of working with you and almost like a life coach to help achieve those different factors. And each of these factors will all have a part to play. And
what you've just said there is that component of what we're talking about, the education component, which covers a lot of this, including the physical side, understanding how your body moves. Okay, brilliant. Well, it's been really good this. I feel like we've got a lot covered over these talks.
I hope you found it useful.
Yeah.
So next time when you're in pain, or if you are in pain now, think about your pain from a really broad perspective and start to generate a problem list that encompasses not just the physical, the sleep, the stress. And then if you come in and see a clinician, whether it's us or whether it's anywhere else, start to think about these kind of problems or these issues that need to be addressed, looking from a bigger picture.
On that note, if you want advice or you want help, then we do offer a free phone consultation at the clinic here. You can come in person for 10-15 minute chat as well if you want to, or you can private message us via Facebook or contact us via the website. We're happy to talk to you guys over the phone as well, just to get in touch really and see if we can help you. For now, that's me, Dan Smith, and Scott Cook signing off. We wish you a good day. All the best.
Cheerio.